support all the region, but more particularly sub-Saharan Africa, to accompany them in addressing this gap and reducing maternal deaths and also reducing inequalities.
Hello, I'm Professor Agbesi Amuzu. I have good news. The Countdown to 2030 did it again. This year's report is very comprehensive and produced by the Lancet and explain the drivers or the reason behind the slowing down of progress for women and children's health. Healthcare must be accessible, equitable, of high quality, because everyone deserves the best care at every stage of life. Join us on April 14 for the launch of the Countdown to 2030 2025 report. Thank you.
Hi everyone, I'm Ties Boerma. I'm a professor of population and global health at the University of Manitoba and a collaborator in the Countdown to 2030 for women, children and adolescents' health. I'd like to draw your attention to an upcoming report launch of the Countdown in the Lancet. This report presents a comprehensive analysis of progress in reproductive, maternal, newborn, child and adolescent health and nutrition, and shows that even though there's been progress, there are some major slowdowns, which means that many countries will not be able to reach the Sustainable Development Goal targets, especially in sub-Saharan Africa. It also shows that there are worrisome headwinds such as economic stagnation, armed conflict, and also recent declines in international assistance. So please join us on April 14 at the launch of the 2025 Countdown Lancet Report. Thank you.
Health doesn't exist in isolation. Integrating reproductive, maternal, newborn, child and adolescent health and nutrition across all sectors improves health and saves lives. Join us on April 14th for an engaging conversation as we launch the Countdown 2030 Lancet Report of 2025. The report examines trends in child survival, in nutritional status, in health systems performance, in terms of coverage, in terms of policies and financing, and using an equity lens, of course with a focus on non-middle income countries where the majority of mother, child and adolescent health issues occur. If you want to participate, register at the link below.
Hello everyone, I'm Dr. Jennifer Harris-Hikasia with the Global Financing Facility for Women, Children and Adolescents. Better data equals better decisions. The 2025 Countdown to 2030 Lancet Report identifies progress in reproductive, maternal, newborn, child, and adolescent health and nutrition, and major gaps, including major data gaps, that we need to address to drive real action. Let's discuss the findings on the 14th of April in Dakar. Thank you so much. Looking forward to seeing you all there.
Climate change, pandemics, economic crisis, and the multiple socio-political upheavals are amongst the multiple risks that are threatening reproductive, maternal, newborn, child, adolescent health and nutrition progress. Innovation remains key to protecting the already weakened health systems. You won't regret being part of the conversation as we launch the 2025 Countdown Lancet Report. Register using the link below.
So one of the key points from the report has to do with the focus on sub-Saharan Africa that has been highlighted in the report as a very critical region where the burden of maternal and child death is still prominent, And one of the things that we are saying is it's important to focus more than ever on this region where critical action are needed to prioritize, to make sure that we save lives, we save children, we help also mothers and their babies. So our word is let us support all the region, but more particularly sub-Saharan Africa, to accompany them in addressing this gap and reducing maternal deaths and also reducing inequalities.
Hello, I'm Professor Agbesia-Amuzu. I have good news. The Countdown to 2030 did it again. This year's report is very comprehensive and produced by the Lancet and explain the drivers or the reason behind the slowing down of progress for women and children's health. Healthcare must be accessible, equitable, of high quality, because everyone deserves the best care at every stage of life. Join us on April 14 for the launch of the Countdown to 2030 2025 report. Thank you.
Hi everyone, I'm Ties Boerma. I'm a professor of population and global health at the University of Manitoba and a collaborator in the Countdown to 2030 for women, children and adolescents' health. I'd like to draw your attention to an upcoming report launch of the Countdown in the Lancet. This report presents a comprehensive analysis of progress in reproductive, maternal, newborn, child and adolescent health and nutrition, and shows that even though there's been progress, there are some major slowdowns, which means that many countries will not be able to reach the Sustainable Development Goal targets, especially in sub-Saharan Africa. It also shows that there are worrisome headwinds such as economic stagnation, armed conflict, and also recent declines in international assistance. So please join us on April 14 at the launch of the 2025 Countdown Lancet Report. Thank you.
Health doesn't exist in isolation. Integrating reproductive, maternal, newborn, child, and adolescent health and nutrition across all sectors improves health and saves lives. Join us on April 14th for an engaging conversation as we launch the Countdown 2030 Lancet Report of 2025. The report examines trends in child survival, in nutritional status, in health systems performance, in terms of coverage, in terms of policies and financing, and using an equity lens, of course with a focus on non-middle income countries where the majority of mother, child, and adolescent health issues occur. If you want to participate, register at the link below.
Hello everyone, I'm Dr. Jennifer Harris-Hikasia with the Global Financing Facility for Women, Children, and Adolescents. Better data equals better decisions. The 2025 Countdown to 2030 Lancet Report identifies progress in reproductive, maternal, newborn, child, and adolescent health and nutrition, and major gaps, including major data gaps, that we need to address to drive real action. Let's discuss the findings on the 14th of April in Dakar. Thank you so much. Looking forward to seeing you all there.
Climate change, pandemics, economic crisis, and the multiple socio-political upheavals are amongst the multiple risks that are threatening reproductive, maternal, newborn, child, adolescent health and nutrition progress. Innovation remains key to protecting the already weakened health systems. You won't regret being part of the conversation as we launch the 2025 Countdown Lancet Report. Register using the link below.
So one of the key points from the report has to do with the focus on sub-Saharan Africa that has been highlighted in the report as a very critical region where the burden of maternal and child death is still prominent. And one of the things that we are saying is it's important to focus more than ever on this region where critical action are needed to prioritize, to make sure that we save lives, we save children, we help also mothers and their babies. So our word is let us support all the region, but more particularly sub-Saharan Africa, to accompany them in addressing this gap and reducing maternal deaths and also reducing inequalities.
Hello, I'm Professor Agbesia-Amuzu. I have good news. The Countdown to 2030 did it again. This year's report is very comprehensive and produced by the Lancet and explain the drivers or the reason behind the slowing down of progress for women and children's health. Healthcare must be accessible, equitable, of high quality, because everyone deserves the best care at every stage of life. Join us on April 14 for the launch of the Countdown to 2030 2025 report. Thank you.
Hi everyone, I'm Ties Boerma. I'm a professor of population and global health at the University of Manitoba and a collaborator in the Countdown to 2030 for women, children and adolescents' health. I'd like to draw your attention to an upcoming report launch of the Countdown in the Lancet. This report presents a comprehensive analysis of progress in reproductive, maternal, newborn, child and adolescent health and nutrition, and shows that even though there's been progress, there are some major slowdowns, which means that many countries will not be able to reach the Sustainable Development Goal targets, especially in sub-Saharan Africa. It also shows that there are worrisome headwinds, such as economic stagnation, armed conflict, and also recent declines in international assistance. So please join us on April 14 at the launch of the 2025 Countdown Lancet Report. Thank you.
Health doesn't exist in isolation. Integrating reproductive, maternal, newborn, child and adolescent health and nutrition across all sectors. The report examines trends in terms of coverage, in terms of policies and financing, and using an equity lens, of course with a focus on non-middle income.
Drive real action. Let's discuss the findings on the 14th of April in Dakar. Thank you so much. Looking forward to seeing you all there.
Climate change, pandemics, economic crisis, and the multiple socio-political upheavals are amongst the multiple risks that are threatening reproductive, maternal, newborn, child, and the already weakened health systems. You won't regret being part of the conversation as we launch the 2025 Countdown Lancet Report. Register using the link below.
So one of the key points from the report has to do with the focus on sub-Saharan Africa that has been highlighted in the report as a very critical region where the burden of maternal and child death is still prominent. And one of the things that we are saying is it's important to focus more than ever on this region where critical action are needed to prioritize, to make sure that we save lives, we save children, we help also mothers and their babies. So our word is let us support all the region, but more particularly sub-Saharan Africa, to accompany them in addressing this gap and reducing maternal deaths and also reducing inequalities.
Hello, I'm Professor Agbesia-Amuzu. I have good news. The Countdown to 2030 did it again. This year's report is very comprehensive and produced by the Lancet and explain the drivers or the reason behind the slowing down of progress for women and children's health. Healthcare must be accessible, equitable, of high quality, because everyone deserves the best care at every stage of life. Join us on April 14 for the launch of the Countdown to 2030 2025 report. Thank you.
Hi everyone, I'm Ties Boerma. I'm a professor of population and global health at the University of Manitoba and a collaborator in the Countdown to 2030 for women, children and adolescents' health. I'd like to draw your attention to an upcoming report launch of the Countdown in the Lancet. This report presents a comprehensive analysis of progress in reproductive, maternal, newborn, child and adolescent health and nutrition, and shows that even though there's been progress, there are major slowdowns, which means that many countries will not be able to reach the Sustainable Development Goal targets, especially in sub-Saharan Africa. It also shows that there are worrisome headwinds, such as economic stagnation, armed conflict, and also recent declines in international assistance. So please join us on April 14 at the launch of the 2025 Countdown Lancet Report. Thank you.
Health doesn't exist in isolation. Integrating reproductive, maternal, child and adolescent health and nutrition across all sectors improves health and saves lives. Join us on April 14th for an engaging conversation as we launch the Countdown 2030 Lancet Report of 2025. The report examines trends in child survival, in nutritional status, in health systems performance, in terms of coverage, in terms of policies and financing, and using an equity lens, of course with a focus on low and middle income countries where the majority of mother, child and adolescent health issues occur. If you want to participate, register at the link below.
Hello everyone, I'm Dr. Jennifer Harris-Hikasia at the Global Financing Facility for Women, Children and Adolescents. Better data equals better decisions. The 2025 Countdown to 2030 Lancet Report identifies progress in reproductive, maternal, newborn, child, and adolescent health and nutrition, and major gaps, including major data gaps, that we need to address to drive real action. Let's discuss the findings on the 14th of April in Dakar. Thank you so much. Looking forward to seeing you all there.
Climate change, pandemics, economic crisis, and the multiple socio-political upheavals are amongst the multiple risks that are threatening reproductive, maternal, newborn, child, adolescent health and nutrition progress. Innovation remains key to protecting the already weakened health systems. You won't regret being part of the conversation as we launch the 2025 Countdown Lancet Report. Register using the link below.
So one of the key points from the report has to do with the focus on sub-Saharan Africa that has been highlighted in the report as a very critical region where the burden of maternal and child death is still prominent. And one of the things that we are saying is it's important to focus more than ever on this region where critical action are needed to prioritize, to make sure that we save lives, we save children, we help also mothers and their babies. So our word is, let us support all the region, but more particularly sub-Saharan Africa, to accompany them in addressing this gap and reducing maternal deaths and also reducing inequalities.
Hello, I'm Professor Agbesia-Amuzu. I have good news. The Countdown to 2030 did it again. This year's report is very comprehensive and produced by the Lancet and explain the drivers or the reason behind the slowing down of progress for women and children's health. Healthcare must be accessible, equitable, of high quality, because everyone deserves the best care at every stage of life. Join us on April 14 for the launch of the Countdown to 2030 2025 report. Thank you.
Hi everyone, I'm Ties Boerma. I'm a professor of population and global health at the University of Manitoba and a collaborator in the Countdown to 2030 for women, children and adolescents' health. I'd like to draw your attention to an upcoming report launch of the Countdown in the Lancet. This report presents a comprehensive analysis of progress in reproductive, maternal, newborn, child and adolescent health and nutrition, and shows that even though there's been progress, there are some major slowdowns, which means that
and the important role of APH+C is the production of evidence-based data and also to stimulate sustainable development in the African continent. The initiative Countdown for 2023 for the health of the women, the children and the teenagers is working with academia, with the UN, as well as with many other partners who are involved to accelerate the progress toward the but also several points are on the agenda that will be developed by the whole team of APH+C, but also with our partners, namely the presentation of the major conclusion and recommendation of the 2025 Countdown report with Lancet. Discussions will be held on the translation of the evidence-based data, of the political commitment that are taken, and also the programmatic issues in order to develop the RMNCAH. We'll also deal with the collaboration, intersectoral collaboration for the improvement of the efficiency and the scope of the RMNCAH interventions. Before starting this agenda, I would like to recognize the presence of our distinguished honor, the Ministry of Health, Dr. Ibrahim Masih, who will join us in a minute. Ladies and gentlemen, the senior executive of the government, ladies and gentlemen, members of the civil society organizations, ladies and gentlemen, members of the academia and research institution, ladies and gentlemen representing the media, dear colleague journalists, ladies and gentlemen, representative of the donor organizations and partners, development partners. Without further ado, we are going to start today's agenda, and to do so, I would like to call, please, with a standing ovation, the five people who will be doing presentation, this introductory remarks to this event. Please, round of applause. I'm calling the director of APH+C, Western African Health Research Council and Director of the Countdown Initiative, Dr. Cheikh Mbacke. Please, round of applause for Dr. Cheikh Mbacke. Tis Boma, Professor at Manitoba University of Okan in Canada. I also would like to call Professor Agbesi Amusu from the University of Johns Hopkins in the USA. Please, round of applause for him. I would like to call Professor Aluso Barroso from the University of Pelotas in Brazil. And last but not the least, of course, I'd like to call Jennifer Harris, Rekejo, from Johns Hopkins and from the GF and the World Bank initiative. Please, round of applause. The first speakers will make a presentation of several parts of this program, and we will start with Dr. Cheikh Mbacke, who will set up the scene of the report and a summary of the result and the presentation of the countdown to 2030. Over to you, Doctor. Thank you very much.
People are looking very good in the screen here. Like, we are good today. So welcome to Dakar. Welcome to Azalai Hotel. We are very happy that you make it. You made it finally, because it was not given. And we know that you had to postpone, reschedule a number of activities for you to be in Dakar. So we appreciate that, and we want to thank you so much for that. So this is just to give you a background on this report, for you to know the context and why we do this and where are we heading with this report. So my name is Cheikh Mbacke. I'm heading the West Africa Regional Office for the African Population and Health Research Center, APHRC, which is leading the Countdown 2030 initiative in Africa. And I'm happy that today we are launching this report. This has been a work that started about 2 to 3 years ago, and then it's only now that we are able to have this report. So we want to thank everyone who contributed to this, and the batch of authors who will be presenting the report today will be on behalf of the over 50 authors who have been who contribute to this report. So thank you so much. My slides are going to be very brief. I think this is just an overview of the program, what you are going to see today, in terms of taking you through the general introduction on the report, and then my other colleagues are going to follow. But before I do that, let me just give you a view of what the countdown is about. I think most of you have been working with the countdown over the years, probably, but some are a bit new, and maybe some are getting to understand what is the countdown, what are they counting down. And today we are going to tell you exactly what the countdown is about. The countdown is a global partnership of academic and UN partners, but also with civil society, who have been working over the years to track and monitor progress towards the SDGs. And before, it was actually focusing on the MDG. That was when we started in 2003 or 2005, around there. So the mission is to provide global, regional, and country evidence for advocacy planning, but also how to enhance reproductive, maternal, newborn child health and nutrition. The focus is mainly on coverage and equity, but also looking at the drivers. And the countdown focused mainly on what we call the low and middle income countries. That's where we look at, and I think this report mainly focuses on this. and we produce very regularly some output, both at global level, but also at country level. Global level, where we have academic publication, some report, global regional report, but also country profile. I think most of you who have been in the Countdown website have seen the equity profile, the ECD profile, and other profile that we generate every year. So it's important that you see those type of things that we do. Now, when we talk about the country collaboration or the collaboration, the network of the Countdown in sub-Saharan Africa, this is what we talk about. We talk about 26 countries in both East and Southern Africa, but also West and Central Africa. So it's a very strong network where we have academic and public health institutes who are leading the initiative in each of those countries, but also working together very closely with government. And here by government, we mean all the analysts and researchers who are within the Ministry of Health, but also who are in charge of tracking progress or monitoring progress with related to RMNCAH. So this is the network that you see. It's a very strong network of over 200 people who have been working together over the years, and that's why it is very, very, very strong. Of course, it goes beyond Africa. So here you see the sub-Saharan Africa countries, but also we also intervene in South Asia and also some other countries in America. So these are just some type of report, because we talk about the Lancet report, which speak to one of the key outcomes of the Countdown, which is global monitoring. So this report is part of the global monitoring activity that we do in the Countdown, and where you see we try to track child survival. That's how we started, to now a broader agenda of reproductive, maternal, newborn, child, and adolescent, and then nutrition. So wherever you see RMNCAH, there's also an N. So the N means nutrition. And I think some people will be very happy to see here what we do in nutrition. So some analysis that we do in a very comprehensive way to track progress and performance, but to inform advocacy and action. And since 2005, we partner with the Lancet. And the Lancet is supporting us, and thanks, Pamela, for being here. The Lancet have been supporting the Countdown to, have this report at the global level that are done every 4 or 5 years. And our last one was, I think, around 2018 or around there. And this is the one that we have this year. The most recent report was in 2018, that's what I've said. And you see the cover pages of those reports that are here, and also some other product that we also do. So what is the purpose, and why do we have this report? It is a kind of snapshot, kind of midpoint review of the SDG area between 2016 and 2023. That's what we are trying to look at here. But mainly to assess progress in 4 areas. Mortality and nutrition, number 1. Number 2 is coverage, quality, and equity. Number 3 is health system readiness, and then policy and health financing. So those are the areas that are covered by this report that we are going to present today. And there's a spotlight on sub-Saharan Africa, but specifically in West and Central Africa. So this report is going to tell us today where we are on those areas, but specifically focusing on West and Central Africa. Why this report is important now? It is important because we all know, we have seen that there is some kind of slowdown at the global level in progress in RMNCAH. That is actually what we see since 2015. And then there are also some step back that we need to appreciate. That is also to set up the context of this report. 3-1. The first one is the COVID pandemic. I think that has changed a lot of things in what we do. That has almost challenged a little bit the health systems in general in these countries. The second one has to do with climate shocks, conflict, and economic crisis. We could not look at progress without looking at as well, or connecting them with these issues. They are very important. And you will see in which way the progress is speaking to also this issue. And the last one is also a kind of decline in development assistance, which is very up to date now, because everyone talk about that. But when we look at this report, we also have seen that has not started now. Maybe over the years, we've seen the decline in foreign assistance in general. But lastly, the SDG target are increasing at risk, because if you look at this report, you are going to see how many countries are on track to achieving the SDG. In Scott RMNCAH, you will see that we are really challenged. If you want to really achieve the SDG with regard to some indicator, we need to really do something that is very specific. We need to do a bit more than what we do now. And we also had this focus on sub-Saharan Africa, which is home to 56% of child adolescent deaths that you know very well, but also about 70% of maternal deaths globally. So that's what this region is about. I think most of you actually can mention that and can go deeper into those issues. The second one also is high fertility. I think you all know that. We are still facing with this high fertility. To know that there are countries where we still have about more than 5, 6, in terms of fecundity rate. I think that's also something that we need to appreciate. Also the youthful population and fragile system. Those systems have been challenged, and we've seen them. I think it's important to know that that's what Sub-Saharan Africa is about. The third thing is also appreciating the top effort, but also the inequality that is also persisting throughout this region. And finally, there's an urgent and very important need for prioritizing the region, for even including focusing on sustainable financing, but also to enhance the systems in this region. So this report calls for action, building on the evidence that we are going to share with you shortly, but also it speaks to the action. In which way we are going to recommend, to tell you what are our recommendations with regard to the health systems, with regard to equity, and also our recommendation with regard to data accountability. That's very important. We are at the very critical moment where data are becoming more and more central. We know what it is, and we are likely to not have the same level of information going forward. So what it means is it's important for us to really look at this and probably see what recommendations are we coming up with. But also centering more and more RMNCAH in a broader development agenda. I think we've been almost missing RMNCAH in the way we have been prioritizing the global level agenda. So it's important that now RMNCAH come back as the core thing to look at going forward. And finally, looking ahead, we are inviting you to go a bit, we are going to do a kind of deep dive to explore country experiences and solutions. We also want to continue the collaboration with government, our partners, but also in civil society. So those three are very important, and we are going to continue working with them. And lastly today, let's dialogue. Let us have this dialogue fuel the next phase of our collective journey to the SDGs. So this is our message, and this is setting a little bit the context of the report and why it is important. At this stage, I'm going to invite Professor Boma to take us through the first agenda, the first item, which speaks to the determinant. Thank you so much.
Thank you very much. Another round of applause for Dr. Cheikh Mbacké Faye, please. Thank you so much for this in-depth introduction. We're going to now hear, as he said, from Professor Thies Bouma. He's going to talk to us about the contextual determinant about the SR-MANIA. A round of applause for Professor Thies Bouma.
Thank you very much. And I mean, Cheikh is always a very hard act to follow. So all I have to do is repeat some of the points that he's made, and then I'll hand over to my colleagues. Next slide, please. Or am I? Oh, I'm doing it. Huh? And okay, good. Okay. So basically, a few things on the report. So as Cheikh said, we looked at the 134 low and middle income countries, with special attention to the 70 low and lower middle income countries and the high mortality regions of sub-Saharan Africa and South Asia. And we compare the pace of progress since 2016, which was the start of the Sustainable Development Goals, to today, with what happened before 2016, so from 2000 to 2015, which was the Millennium Development Goals, and assessed whether there was SDG target pace, which is the upper line. Oh, I probably have a... No. Or the second green line, which is basically the continued pace from the MDGs, or whether there was a slowdown of progress, or a stagnation, basically no more improvement, or even a reversal. So that was our focus. So as Sheikh said, there is an uneven distribution of population, birth and death in the world, but 15% of the world's population lives in sub-Saharan Africa. 31% of the births occur in sub-Saharan Africa, 40 million. 56% of child and adolescent deaths occur in sub-Saharan Africa, and 72% of the estimated number of maternal deaths. The other thing that was a central feature is that we tried to take a comprehensive look at maternal and child health. So while we're paying attention to all the components, stillbirth, neonatal death, child under 5, older children, adolescents, and maternal death, we also look at it in a combined way. So 0 to 19 years. And if we look at the population distribution by age, we see that in the West and Central Africa region, currently 54% of the population is under 20, whereas in other regions of the world, except in Eastern and Southern Africa, it's more like 1/3. And that, of course, makes a huge difference of how much resources should go to women, children, and adolescents' health. Now, this is sort of a summary of a very broad analysis in which we involved many experts from around the world about the determinants. Because as we know, health systems are very important for women, children, and adolescents' health, but there are many other factors. So first, the economic determinants, we see a slowdown of economic growth, stagnating poverty reduction, major debt crisis in many countries. In 2021, 25 of 43 countries in sub-Saharan Africa, with data, spend more on public external debt than servicing of the debt than on health. So, and that's not a good development, obviously. In terms of the social determinants, there's still progress in education, there's still progress in gender equity, but it's much slower than before 2015. In terms of food security, that actually also got worse during the SDG period, fueled by the COVID pandemic and also economic volatility as well as conflict. And I'll come back to that in a second. The COVID pandemic also led to a shift in resources and a drop in service utilization for women and children's health. But on a positive note, the rapid rebound of service utilization and service provision that almost all countries showed was remarkable. Then lastly, climate change poses a severe threat to women, children, and adolescents' health, even though impact of natural disasters on mortality has been modest to date. Another obstacle is armed conflict. So what we've seen with some new analysis is that more countries were affected by conflict during 2016 to 2022 than before. We estimate that over 300 million women and more than 500 million children live near conflict zones. That's a 26% increase since 2015. And the number of women and children younger than 18 years who are uprooted by conflict, meaning they're refugees or they're internally displaced, increased from 46 million in 2015 to 81 million in 2023. So this map shows the concentration, because the red means countries with higher numbers of refugees and displaced persons. The dots are severe conflict events, the concentration in sub-Saharan Africa, but also parts of the Middle East, and we of course see Afghanistan and other countries, Myanmar and Ukraine. So to conclude, there are multiple challenges for continued fast progress in reproductive, maternal, newborn, child and adolescent health and nutrition. Women and children living in the least favorable social and economic environments where multiple dimensions of inequality intersect are the most vulnerable to the consequences of these challenges. Thank you.
Thank you very much, Professor Thies Boerma, professor from the University of Manitoba in Canada. I'm going to introduce right now, with a round of applause, of course, always, Professor Agbesi Amuzu from University of Johns Hopkins in the United States to talk about the progress made in terms of nutrition and avoiding mortality.
Thank you very much. Okay. I hope this clicker will do a better job today. You can do it first. All right. What did you do to the clicker? Oh, okay. All right. Thank you very much. Well, they're trying to. I think they're loading the presentation, but let's give them a few seconds to upload. Is it loaded now? All right. For mortality, I'm just going to have to start without the slide and go by what we presented in the slide. We'll give you just a flavor, a summary of what is in the report. And for mortality, we started by analyzing deaths under age 20, starting from stillbirth all the way. Because these 2 decades of lives are critical for the formation of human capital. And globally, 8 million, I should say, deaths in this period occur in 2023 as estimated by the United Nations. And of these, the pie chart there, I'm not sure if you can read clearly, shows that most of these, a large majority of these deaths occur in under 5. And half of these occur in as stillbirths and neonatal deaths. 260,000 maternal deaths occur in 2023. As estimated by the United Nations. We look at the distribution of the mortality, the risk of mortality by by income groups and age groups. And what the chart here shows you is the disproportionately concentrated mortality in low income or lower middle income groups. When you take the mortality, overall mortality, for example, the low-income groups experiences over 4 times the mortality risk seen in upper middle-income groups. And more specifically, if you take the neonatal mortality, which is written as NMR there, or under 5 mortality rate, or U5MR, the proportion, the ratios are even higher. And we can also see that considering neonatal mortality rate, the upper middle income countries have already achieved the SDG target as a group when considering also the under 5 mortality rate as well. So we look at the distribution, similar distribution by region. And the top 3 regions with the highest mortalities are highlighted in the top there, which include the 2 regions in Africa, Sub-Saharan Africa, West and Central Africa and Southern Africa, and South Asia. So these regions, as were mentioned by my predecessor, really have been a focus of this report. Then we look at the trend in mortality, comparing the MDG to the SDG period, and looking at using the annual rate of reductions. And the annual rate of reductions for the MDG period, which is now in blue there, and the SDG period in green, what we want to look at is which bar is taller. The taller one will be more acceleration. And what you can see is that with a few exceptions, there has not been any acceleration, or there's a slowdown of mortality decline all across low income and lower middle income. We look at this also by region, and this time you see the darker brown is the MDG period and the light brown is the SDG period. And what we still observe is the a slowing down or no acceleration in Eastern and Southern Africa region. In West and Central Africa, the reduction has been really slow in the MDG period and continue to be low in the SDG period. And we see that in South Asia, the rates are slightly higher, and so they have maintained the rate of decline, although there has not been any further accelerations. Then we look at causes of death in children under 5. And at the top there, you have the neonate, and the bottom is the among the children 1 to 59 months by region in Africa and South Asia. You may not be able to distinguish all the color schemes here, but what this shows is that prematurity comes on top as the main cause of death among the neonates, and among the 1 to 59 months, infectious diseases predominate as main causes of death, including lower respiratory infections or malaria that remain the top. But importantly, also, there has been a slowdown in cause-specific mortality rates, with a rise in or stagnation in a few of them, including malaria, for example, and injury deaths. Here, the report highlighted the important need for better data, more data on causes of death for better monitoring. Then we look at maternal mortality trends. As you can see, also looking at the annual rate of reductions in maternal mortality, there has been a clear slowing down of the decline during the SDG period. And specifically in West and Central Africa, the decline has continued to be slow as in the SDG period as was in the MDG period. Here too, the report emphasized the need for better data for better monitoring of maternal deaths. Nutritional status continue to be critical in more children in around the world, and specifically in low and middle income countries. And we assess the trend by income groups and regions. And on the left, you see the trend. On the right, we analyze the annual rate of reduction in stunting. And what we observe is continued high rate of stunting in Sub-Saharan Africa and South Asia, although there has been some convergence in both regions due essentially to a slowing down of the trend in Sub-Saharan Africa and an acceleration that is observed in South Asia. There has been an acceleration in stunting decline in lower middle income countries, but a slowdown in the upper middle income countries. The report also analyzes the inequality in nutritional status, which shows that the inequality gaps have continued to be maintained in the SDG period, and in wasting status also declining very slowly and more prevalent in South Asian region. So, in summary, the report touches on concluded on many points. First of all, we see there's still a decline, continued decline overall. However, very insufficient to achieve the SDG target for mortality, and specifically in Sub-Saharan Africa, slowing down of the progress in East and Southern Africa, whereas West and Central Africa continue to experience very low decline in mortality. South Asia is progressing at a higher rate and has maintained its high rate of decline, although the acceleration that is expected is not happening. Prematurity remains the top cause of death among neonates. Infectious diseases predominate among children 1 to 59 months. Stunting prevalence remain high and declining very slowly, but we observe larger decline in South Asia during the SDG period. The report also highlights the nutrition transition that is happening among older and adolescent girls, whereby there is a rise in obesity that is happening alongside a decline in underweight. All right. This is really a sneak peek of what the report is showing. A lot more is in the report that I invite you to read. Thank you very much.
Thank you very much, Professor Agbesi-Amuzu. Now the question remains, what kind of progress were we able to make in terms of equity, quality, and covering? And that's a question for Professor Alujo Barros from University of Pelotas in Brazil. A round of applause for Professor Alujo Barros. Thank you.
Okay, thank you. Well, it's a privilege to be here this afternoon and present a very short summary of what we did in section 3 of this report about trends in health intervention coverage, equity, and service quality. So first, coverage of what? So Countdown, since its start, has been focusing on proven essential health interventions that reduce adverse outcomes, that help decrease maternal and child mortality, and improve nutrition. So to the right, you can see this continuum of care chart that has been sort of a signature graph of all of the Countdown reports that shows exactly the level of coverage for a series of selected interventions. And I will be presenting as well, in terms of trends, the composite coverage index that is a weighted average of 8 selected interventions that help give sort of a general idea of how a country is doing in terms of health coverage. So looking at this graph in a bit more detail, we have a list of essential life-saving interventions. The bars show the median coverage in lower middle-income countries. Sources are different, so the number of countries contributing to each of these bars vary a bit. And looking at it, we see good levels of coverage for some of the interventions, like antenatal care, skilled birth attendant, postnatal care, vaccines. But on the other hand, disappointing coverage levels for family planning, for early initiation of breastfeeding, for mosquito nets. So something's good, something's not so good. Jumping to trends in the CCI coverage, what we see is that, looking at the graph more to the right, where we show all 70 countries, low and middle income countries with data, we clearly see that the speed with which coverage was increasing slows down in the SDG period. So it goes from 1.2 percentage points per year to half percentage point per year in the SDG period. If we examine the middle graph in more detail, Eastern and Southern Africa, we see that deceleration very clearly. So it slowed down, but not only slowed down, it basically stagnated. So from 1.5 percentage points per year to statistically zero progress in the SDG period. And finally, we look at West and Central Africa on the left-hand side graph. And then there is a bit of good news, because in this region, what we see is an acceleration in growth of the CCI coverage from 0.6 to 1.6 percentage points per year, sort of showing that in some places we are sort of doing better, but most other regions no. And in the report, you can see what happened in the other regions that I'm not presenting here. Finally, still looking at these graphs, we can see that despite the progress observed, the two regions in sub-Saharan Africa are way behind the average of all the 70 countries. So with Western Central Africa, some 20 percentage points behind the average, not the best. Next, what's happening with equity and why equity? Health is a human right, and everyone has the right to the best achievable health, and that's what we believe. What are health inequalities or inequities? So differences across population groups that are systematic, socially produced, and deemed unjust and unfair. So it is our mission as health professionals to fight against these inequalities and make different groups in terms of wealth, geography, ethnicity have the same levels of health and access to health interventions so that we leave no one behind. What happened with equity? Good news, we had a reduction in health inequalities along all the period we studied, with an actual acceleration in the SDG period compared to the MDG period. And why did this happen? Basically, we see in the lower graph, the smaller one, that among the poorest group, the 20% poorest, the increase in coverage was steady and went on through the whole period. The wealthiest, on the other hand, sort of stalled. So the decrease in inequality is good news. We have less inequalities, less inequities, but stalling the increase among the wealthiest is not a good thing, because it usually mirrors what's going to happen with the poorest in relatively short time. So we have to be careful about that and see what's going on that we are not managing to improve the wealthiest more than we have now. We also explored some indicators of health service quality, and here we have the antenatal care quality indicator, ANCQ. This indicator is a score that includes information on contact with services like the number of antenatal care visits and content of service, including things that were done during antenatal care like collecting blood or urine and so on. What we present here is the percentage of women that had good quality antenatal care, that is 8 or more points in this indicator. And what we see here, and I highlighted low-income countries, is that most countries had good progress and increased coverage. And that is true for most of the countries we studied, except some upper middle-income countries that already had relatively high coverage. But we see progress, but most of these countries still have a very low coverage of high-quality antenatal care. So there is still a lot of progress to be done. Last bit of information I will present is about C-sections. And C-sections are a very important intervention to save lives of mothers and newborns. WHO currently recommends around 70% C-sections that should be enough to cater for medical indications and reduce maternal mortality. But what we see here is when we look at C-sections among the poorest women and the wealthiest women, the percentage of C-sections among the poorest is low and basically didn't increase from the MDG to the SDG period, while among the wealthiest women, we see progress, and in most countries, we already have more than the 10% that we are aiming for. So, wealthiest women receiving more than they need, and the poorest women well below the target we have, what is really a big problem and one of the difficulties in reducing further maternal mortality. In summary, what we saw is that coverage with essential health interventions continues to increase in the SDG period, but at a lower pace compared to MDG. Because progress among the poorest was sustained and progress among the wealthiest is stalled, we saw an important reduction in inequalities, but we need to be sort of careful about that and understand what's going on here. There was good progress in most countries in terms of ANC quality, but still many countries with low coverage, and C-section very badly distributed across wealth groups, with wealthiest women having more than they need and the poorest women having way less than they need. So, some good news, some bad news, and much more to read in this report. Thank you.
Thank you very much, Professor Alusio Barros. Alors, mesdames et messieurs, je vais vous demander 1 minute, qu'on se lève tous 1 minute pour accueillir Monsieur le ministre de la Santé, Dr Ibrahim Assi, qui va faire son entrée tout de suite dans l'audience. Si on peut l'accueillir sous vos ovations, s'il vous plaît. Sous vos ovations, Monsieur le ministre Dr Ibrahima Sy, ministre de la Santé du Sénégal.
Of Senegal,
Nous accueillons
whom we are very happy to receive today for this event. Honorable Minister, you're welcome to this gathering. Thank you very much. Please be seated, Honorable Minister.
Et juste avant
And just before giving the floor to the Honorable Minister, we would like to call the high table to come in here and to be ready after the speech of the minister. And for that, I will call the director of Countdown, who is next to me, Dr. Sheikh Mbacke. We also would like to have the representative of WHO, TAM CA, the UNICEF representative, regional director of UNFPA, GFF representative who will give a video message, and representative of PNS and H video, the gate representative also be ready, and also the editor of the Lancet. To all these people be ready, and I'm calling the Honorable Minister of Health of Senegal, Dr. Ibrahima Sy, to come for a speech on the Thank you very much. It is a real pleasure for me to be here with you after many, many years. Appreciative contribution as a researcher in the Department of Geography. I'm also very happy because I am meeting here people with whom I had worked with in the past. We have Teeth, we also have many, many others. And I remember also of the heated debate that we great pleasure and an honor for me to see all the works that we have been doing be achieved and published in a big journal, a journal with international fame. So this is to tell you the importance that the ministry, which help us to take stock of the progress made in a certain number of African countries, but also to address the issues of bottlenecks in relation to this mortality. I am speaking on behalf of the government of Senegal. I am here on behalf of His Excellency, the President of the Republic of Senegal, Bassirou Diomaye Diakhar Faye, for the launching of the Countdown Report 2030 in the Lancet 2025. This report of multi-country analysis, the Countdown, WHO, UNFPA, GSF, PNS, NCA, WHO, and all the stakeholders who have been committed for the achievements of this report and the organization of the important event. Senegal, as you know, a country of hospitality, is very honored to welcome you to this important adolescent health and infant health. This report is timely to support the efforts that is why the vulnerable layers over the last neonatal and infant mortality. According to the last survey, health survey, EDS 2023, maternal mortality is the 153 deaths for 1,000 live births. The rate of infant or juvenile death is 40% for 1,000 live births between 2015 and 2023. The infant mortality rate is 23 23 for 1,000 live births in 2023, and is a very made to achieve this result, among which I can mention the densification of the health map, the promotion of universal health coverage with the free in fighting against malnutrition. All these strategies was facilitated and supported by the existence of a dynamic civil society, but also with a community health policy. Those interventions have been intensified, will be intensified for the years to come, based on an inclusive and transparent approach with the full and effective participation of the stakeholders in a new vision by the year 2050. For a Senegal that is sovereign, rich, and prosperous. Ladies and gentlemen, I am convinced that a strengthened partnership between the ministries in charge of health and your organization can contribute a lot in enhancing the problem relating to our health system. I would like to thank the technical and financial partners who have supported the holding of our presenters, members of the panel who has come from Africa and other parts of the world. I would for its efficiency and for the enhancement of the public policies that targets the women and the children in Africa and in Senegal. I would like to congratulate the local organizing committee who has been working for 6 months with the direction of health of the mother, of the child, for the success of this important gathering. I also wish a full successful deliberation to this meeting on behalf of the President of the Republic, His Excellency Bassirou Diomaye Diakhar Faye, and also for the report of Countdown to 2030 in the Lancet. I thank you for your kind attention. A round of applause for the Minister Ibrahim Massi, the Minister of Health and Social Welfare of Senegal. After this, who is standing, the representative of WHO, you can move ahead, representative of UNICEF and the regional director of UNFPA, and as well as the editor of the Lancet. So we're going to continue with this session of comment with the director of APH or the comment session. Thank you very much. First of all, I would like to thank the Minister for having come to this meeting. We know the heavy schedule that he has. I would not have much to say except that I would like to thank you all, but also to invite you to read the report and also to read the recommendations, because it would be useless to do 2 or 3 years of research to have these results, which are very important, and for this to be put in the drawers. And this I'm calling on to the director in charge of the child health and to the ministries and to the programs of the African countries who are following us for this recommendation to be translated into practical actions. And we count, at level of Countdown, we count on you for this to be done. I know some countries are already in the trend, and we are ready to support all the countries that want to go in that direction for these actions, for these results to be translated into practical actions. This said, I would like to stop there. Maybe I would ask to give you back the floor. I thank you. Thank you very much, Sheikh Mbake, Dr. Sheikh Mbake Faye. Now, for the second comment, we call representative of the Gate Foundation, Mr. Bahabi Ndongo.
Certainly, we've discussed a lot of statistics today, and you've seen numbers and numbers, and we've had decades of showing numbers. But behind those numbers, there are human beings, there are mothers and children. And in a world where numbers become almost like a routine, I think it's important for us to start unpacking what is behind those numbers. lest we become a little bit more attuned and used to the numbers. There are stories of resilience, maternal death by 40%. Newborn deaths are down by nearly a third. So it's something to celebrate and take time to appreciate that it took a collective effort from all of us. However, today we face stark truth. This progress is slow. Time to listen to the countries and start scaling. The work therefore for us is to work with the countries and see how we can move this forward. Themselves, they don't deliver themselves, and they don't save lives if they don't reach the people that need them. So that's why for me here today, we are part of the funding agencies and we work closely across with other funders. Investments moving forward will matter, not only in terms of driving efficiency, but also in terms of listening to the countries and aligning to the priorities of the countries. For education, for every dollar invested in women's health yields a threefold return in economic growth. The future, and that's what we are hearing the governments in this region.
Thank you very much for your words, Dr. Bahati. So I'm going to call for the next commentary, Dr. Senen Hunun, the Regional Director for West and Central Africa for UNFPA. With your ovations, please. Thank you.
Merci beaucoup.
Thank you very much. His Excellency, Honorable Minister of Health and Social Welfare, honorable members of